Other permanent methods of birth control, we kind of talked about them when we talked about the male reproductive system, but there's female sterilization or male sterilization. For females, there's tubal ligation, or you've probably heard of women getting their tubes tied. A woman can have her fallopian tubes tied, or, well, they're closed, so that sperm and egg cannot meet for fertilization. Basically, kind of like the male vasectomy, they go in and cut the fallopian tube and cauterize the ends, making a little gap so that there's no way for the egg to float all the way through to the uterus. It's an outpatient surgical center operation. You can go home the same day of the surgery, resume your normal activities within a few days, and the method is effective immediately. So it's fairly non-invasive. The transcervical sterilization is where they take a thin tube and use it to thread a tiny little device up into each fallopian tube. It irritates the fallopian tube and causes scar tissue to grow and permanently plug the tubes. It can take about 3 months for the scar tissue to grow, so you should use another form of birth control during the time, but then you would return back to your doctor to make sure that the fallopian tubes were fully blocked. That way, again, the egg and the sperm would not be able to meet, so there would be no fertilization. The male sterilization or vasectomy, this operation is done, again, to keep the man's sperm from going to his penis. So when we looked at the male reproductive system, the testicles had the epididymis on top where the mature sperm was stored, and then the vas deferens was attached to that, and that's where the sperm would leave the male reproductive system. So the vas deferens would be cut so that there would be no way for the sperm to get into the semen. Again, it's outpatient surgery, so it's not fairly complicated. The man can go home the same day. Recovery is less than a week. Usually they'll just be a little sore. But after the operation, a man visits his doctor for tests to count his sperm and make sure that the sperm count has dropped to 0. And this could take up to 12 weeks. So another form of birth control should be used until the man's sperm count has dropped to 0. The male vasectomies are more popular than female sterilization, but for females, if you know that you don't want to get pregnant anymore, it is the most 100% sure way to make sure. Again, we can't say it's 100% because I've heard of a ton of people that would still get pregnant this way. For females, there could be a pregnancy that could implant in the fallopian tube after the sterilization process, which could be really dangerous. But the males usually get the vasectomy because they'll be sterile for the rest of their lives. Females eventually will not once we hit that menopause around age 50. So if we can wait it out that long. But if females are really worried about getting pregnant, they'll take it into their own hands. If males are worried about getting anyone pregnant, then they usually get the vasectomy, but a couple would have to decide which method they were going to choose. Although most women and men who undergo these sterilization processes don't regret having the procedure, it's important to consider how permanent they are. It would not be easy to reverse, and it would be fairly impossible for almost all of them. Again, the male vasectomy has been known to kind of reverse itself sometimes, but it's really rare for that to happen. They did studies to see if there was people that regretted having the permanent methods done, and the study found that women who were younger at the time of the procedure were more likely to experience some sort of regret. So again, we're talking about something permanent. If you do it when you're younger and you turn you're in your mid-30s and you wish you wouldn't have done it, that could happen. So there are other forms of birth control to consider, but these are, like I said, pretty permanent. So the doctor is going to really question if this is what you want. The effectiveness of birth control methods is critically important for reducing the risk of unintended pregnancies. And the best way to reduce the risk of unintended pregnancy among women who are sexually active is to use effective birth control correctly and consistently. Pulling out is not an effective way to prevent pregnancy. We've talked about it before, but basically the male will pull out before he has ejaculated into the female. This really isn't effective because there has to be timing, and we'll talk about in a second here, there is such thing as pre-ejaculation, because you want to get the male urethra ready for the sperm to travel through and try to break the acidity down, and you want to get the female vagina ready to take in the male reproductive cell, the sperm. So there's nothing that says for sure that pre-ejaculation would have no sperm in it. It's highly unlikely, but it could still happen. So trying to pull out or put a condom on right before you ejaculate is not a very effective way to prevent pregnancy. This is my sexual exposure chart. This is basically saying we're concentrating now on STDs and STIs, that every sexual partner you have, you are going to be exposed to everybody that they have slept with. It's not like a clean slate every time you have sex with someone. So this chart just shows that if every person you have been with has the same number of partners as you, and that's not accounting for all the other partners that the person they slept with, I mean, things would get very out of hand quickly. But assuming you have been with one person and they've been with one person, you've still been exposed to one person because they haven't had any other sexual partners. If you've slept with two people and the person you're sleeping with has also slept with two people, then you've been exposed to three. If you've been with three people and they've been with three people, you've really been with seven people. And it goes all the way down to where, sorry, it's a little cut off, but if you've slept with 12 people and all those people have all slept with 12 people, you've been exposed to 4,095 other people. Now, when we look at STDs and STIs, and it really is a silent pandemic. I mean, these things spread like wildfire, and it's because nobody knows who's getting them. Your chances of not getting an STD or STI after being with over 4,000 people is pretty slim. So that's why it's really important to consider how many sexual partners that you sleep with. That's why it's also really important to use protection against STDs and STIs, like condoms. And that's why it's also super important to be open about talking about sex with your partners, because I mean, not everyone's truthful in saying how many partners that they've had, and not everyone gets tested after they've had a new partner. So they could have an STD that they don't know about, sleep with you, and then you get it and you have symptoms. So the more people you are with, basically you're exposed to everybody that they've ever been with, and the chances of you getting an STD are a lot higher. STDs and other sexually transmitted diseases. These are all of them. There's a lot of them, and there's differences between bacterias and viruses. I'm going to upload some photos of the posters that we've done in class, and your classmates will make posters of STDs, but basically these are everything that you can contract, and some of them are viruses and some of them are bacterias. Viruses we cannot treat, we cannot cure. We can treat the symptoms. That goes with any virus, like the flu. If you have the flu, we're not going to go to the doctor, and the doctor's not going to magically cure your flu. He's going to give you medicine to treat your symptoms, so you might not have a sore throat or a fever anymore. or a cough, but you're still going to have the flu until your body works the virus out by itself. With STDs, I mean, your body's really not just going to fight it off and magically one day you won't have AIDS. That won't happen, unfortunately. So pubic lice is what it sounds like, and scabies is very similar. They're kind of bugs that can crawl in the pubic area, mostly through pubic hair. Bacterial vaginosis is bacterial, so you can cure it. We have chlamydia, gonorrhea. There's hepatitis. We're talking about the sexually transmitted kind, and again, I'll add more information on these guys in a second here. HIV and AIDS. It's important to note that having an STD can increase your chances of getting HIV, but that is virus. You cannot get rid of that. The human papillomavirus, pelvic inflammatory disease, genital warts, syphilis, trichomoniasis, and of course herpes. And again, I will add more information about these guys in the next video so we understand what exactly they are.